Californians like to think of ourselves as the center of resistance to the Trump regime. But when it comes to healthcare, we just folded our tents without even putting up a fight. It happened last Friday at 5 p.m. when California Assembly Leader Anthony Rendon announced that he would not bring a single-payer healthcare plan up for a vote this year. Now, when it comes to climate change or marijuana, California is ready to buck the federal government and forge our own path. But when it comes to healthcare, the attitude seems to be that we'll sit quietly and wait for Senator McConnell to handle things. Rendon raised legitimate concerns about the current legislation, which is missing some key details and a funding plan. But rather than improve the bill, Rendon just kicked the can down the road and said that maybe he'll take it up next year. This short-circuits the process of committee hearings that should have taken place in the Assembly this year. Allowing the bill to work its way through committee would have fostered a public debate about whether it is cheaper to have one government entity pay for health insurance, such as the Medicare system, or to have private firms profiteering in a broken marketplace where consumers are forced to buy products they have little information about or control over. If the bill was not improved sufficiently to meet Rendon's concerns, he could have simply voted against it. If the bill passed the legislature and Governor Brown felt it was unworkable, he could have vetoed it. Those decisions could then be debated in the upcoming election campaigns. One gets the sense that this public discourse is precisely what Rendon is trying to avoid. Insurance companies, healthcare providers, pharmaceutical firms, and hospitals are among the biggest contributors to California campaigns. The California Medical Association, which has given California politicos nearly $20 million over the past 2 decades, has declined to push the bill, as has California Blue Shield, another huge donor. If Rendon allowed a vote on single payer in the California Assembly, it could force his members to choose between the concerns of these big donors and the concerns of California voters. He spared them from making the choice. It's likely that even after a process of amendments and improvements in the Assembly, a single-payer healthcare bill would still have flaws. No plan is perfect. The Affordable Care Act required dozens of tweaks and changes as it was implemented by President Obama, and it's now jeopardized by Trump's unwillingness to keep making repairs. It's the job of a functional executive branch to implement legislation, and we should not expect that every bill passed will include every detail. Otherwise, we have no flexibility to make fixes as we see how policy changes play out in real life. There are also risks in doing nothing, yet Rendon seems willing to accept those known perils in favor of the unknown challenges we would face in moving to a different system. Now, while it remains unclear what Congress will do at the federal level, simply sitting on our hands and leaving our fate in the control of Mitch McConnell and Paul Ryan is not what you would call leadership. California could pass a bill that is conditional upon the federal government rerouting current funds into our new program. Or, like marijuana or sanctuary cities, we could decide that this issue is important enough for us to go it alone in defiance of federal policies. Those who have concerns about current proposals have an obligation to offer a better alternative, not just shut down the debate. Punting on first down while blaming others may be a move worthy of Donald Trump, but it's not leadership, and it's not what Californians are looking for in our elected officials. I'm Derek Cressman, and that's my conversation starter. Tell me what you think in the comments below, or read this article with full links at www.derekcressman.com.